Most doctors know the side effects from taking medication. But what I don't think hardly any doctors really understand is the side effects from taking multiple drugs, the interaction between certain drugs. Let's talk about some really common medications that can actually cause dementia, or at least put you at a major risk for getting dementia. From my viewpoint, I would get really upset if I got a side effect, especially dementia, from another medication. Let's go through common drugs that have a known side effect of dementia. First category of drugs are those that block or inhibit acetylcholine. That's a neurotransmitter. These drugs include Benadryl, which is antihistamine, certain drugs for depression, as well as drugs that treat an overactive bladder. If someone's on these for a prolonged period of time, their risk for dementia goes way up. Next one is something called Benzodiazepine. This drug treats anxiety, insomnia, and seizures. We're talking about Valium and Xanax. Apparently, this drug affects the central nervous system, aka your brain, and it can greatly increase the risk of getting dementia. Then we have something called PPIs, proton pump inhibitors. Those medications treat indigestion, heartburn, like Prilosec and Nexium. They can increase the risk of cognitive decline. And then the last one, which is a big one, is opioids, like morphine or oxycodone. Anything that creates sedation in the brain, like when you go in for surgery and they give you certain anesthetics, that can greatly affect your cognitive function, leading to dementia. There's also the side effects from drug interactions. And unfortunately, as people get older and eventually end up in an assisted living home or a nursing home, boy, they just are just given medications routinely. In fact, let's interview this gentleman that owns several assisted living homes and see what he has to say.
We have a whole lot of people that come with between 20 and 30 medications each.
Gosh.
Our record is 54. We had a guy who had 54 medications.
What's really unique about your program is you do this very cutting edge, complex therapy called introducing real food, right? I mean, basically you just, it's that simple. You give them real food because, as you told me, like a lot of these nursing facilities or assisted living, they're living on ultra processed food, right?
Very much so. Yes. It's what they use for their budget to keep, costs low, or the big facilities have contracts with large food distribution companies and sort of serve what they provide.
You have to work with the family, of course, and because they have to authorize it, but you have a whole protocol. And give me an example of what foods that you don't give them.
How long have you got? So anything pretty much, if you think of the middle aisles of the grocery store, that's what we avoid. Any packaged food. We really try to avoid any sugars. I have a health coach that has taught my cooks and caregivers how to prepare the food and what foods to prepare. She's given us lists of ingredients that are sugar, basically, but they don't call it sugar. There's 65 different names for sugar. She's taught us how to read food labels. We really try to get one ingredient foods. When you buy broccoli or you buy steak, there's one ingredient on that list. And that's kind of how we do it. Anything with very multiple ingredients or something from a chemistry class, we don't serve them.
So simple. Now, tell me, are any of the people coming to you kind of eventually getting off some of these meds?
Oh, tremendously. We argue with their doctors all the time. We work off their meds frequently. Our personal goal is to get them off. We get a lot of diabetics, so we worked and we've successfully got people off insulin, metformin, blood pressure medications, statins. Obviously, we work with all our medical professionals and get them to deprescribe it. We have to, by the Department of Health, have an order to stop the medications. But we're constantly having those discussions of what we can do. The guy with 54 medications, he's living on his own in an apartment by himself now, and he's down around 20 medications. So to give you an example.
Now, you have people that come to you that were actually in hospice?
Oh, frequently, yes. They discharge from a hospital or rehab on hospice and come to us, and we'll work very hard to get them to no longer qualify for hospice. We call it graduating from hospice.
What type of results are you seeing in general physically?
Physically, we're seeing all sorts of, a lot of the dementia people, we work with an outside company to do a whole bunch of lab testing. Um, but we see hormone levels go up. We see inflammation go way down, vitamin D levels, all kinds of vitamin levels go up. Plus, you see it physically. That we have people come bedbound, and they go into wheelchairs, and the wheelchairs go to walkers, and the walkers go to walking.
Wow.
So, then they can spend more time with their family. We had a 98-year-old gentleman go on a cruise with his family for a week.
Wow.
Something he couldn't have done when he first came to us, and we let them borrow a caregiver. She got a free cruise out of it, and he had the time of his life. Came back, passed away 6 months later, but was very happy those last 6 months.
Amazing. I'll tell you one thing. If I know anyone that is in that situation where they need to go somewhere, I'm referring them to you. So I will, I think you're in Arizona. I'm going to put your link down below so more people can know about it. But it's incredible. I wish more organizations did what you're doing. And I think we need to spread the word. It's really difficult when dealing with someone on a lot of medications to know what is causing what. The other complexity on top of that is you have multiple doctors involved. They each have their own viewpoint. They're each focusing on a different part of the body. There's this term called adverse drug reactions. This is the unexpected side effect directly caused from drugs. 90% of these are underreported. Adverse drug reactions are responsible for 10% of all hospital visits. It's also the fourth leading cause of death. I wanted to bring on a board-certified endocrinologist and ask her some questions about this topic. We know drugs have side effects, but have we studied the interaction between drugs?
Patients don't always know. They get these little package inserts that are in fine print. Most of us, it's too difficult to read those little tiny papers. And, where I practice in India, a lot of medications just come in aluminum blister packs without any insert. So the patient may not really have a list of side effects to read through. Drug interactions is written in tiny print. Busy doctors are prescribing. And what I do is I use a free software. There's a free version of it. It's called Epocrates, Epocrates. And I look for drug interactions there just to keep on top of it because there's so many new medications coming out.
Even when I was in practice, I would have patients come in. They're on 5, 10, 15, up to 20, even more medications. Are you seeing some of that as well? Just the number of prescriptions are just really going high.
Really long, and especially in the space of where you and I see a lot of things is chronic conditions where it's not a fever or a back sprain and you're done with your medications in 4 to 7 days or a course of antibiotics. It's something more prolonged like blood pressure or diabetes, and these pills end up not really being looked at as when do we get you off of it. And that's something I focus on a lot, is to keep looking at the medication list to cut back whenever we can. And a lot of times the patient is going to different specialists. And unfortunately, the busy specialist might be looking at the one body part that they've been asked to look at, and they're not always looking at interactions of what I'm prescribing with what maybe the other specialist is prescribing. So even though I'm an endocrinologist and I still count as a specialist or a top, super specialized, I end up zooming out and doing what a primary care doctor often does, is let's look at all these drugs. And we're so often surprised. You'll see 2 things that cause constipation, 2 things that cause drowsiness. There's so many interactions.
Even with my mother-in-law, she started noticing signs of Alzheimer's when she was getting older. And so I just looked at her medications because she was on quite a few. And I'm like, wait a second. When I started talking to the doctor, I'm like, this causes dementia, right? As a side effect. So do we really need it? I think it was a bladder medication because that's a common one that has a side effect of dementia. So got her off that. She's just started doing better. But I mean, I'm sure you see it all the time.
All the time. And sometimes you're prescribing like a pain medication, and sometimes rebound pain comes in, or an antidepressant. And temporarily, some people have increased negative thoughts.
What I really like about you is you include the diet as part of the equation when you evaluate someone. Like you You emphasize that.
I heard a joke recently where a pet owner was joking that, when you go to the vet with your pet, the first thing the vet asks you is, what are you feeding them?
Wow. Wow. That would be a smart thing to ask, but why don't doctors ask that? That's the question.
For the human pet owners, right? And so it seems like an obvious question for the pet.
I can't think of anything else that contributes to either more health or more disease than what we put in our bodies.
100%. And I talk about this step by step when I work with people over 3 months or 6 months, is the 4 wheels of the lifestyle car. And the first wheel is always nutrition. Is what are we putting in the body? You're putting a medication in the body. So I'm like, we want to reduce the medication. What else is going into your mouth or into your body every day is food. And then we go into sleep, then we go into stress management, exercise, and after that, maybe fasting. But the first wheel is always nutrition.
I also want to talk about some really common symptoms that are directly caused by so many medications. Let's take constipation, for example. Did you realize that the side effect constipation can come from over 150 different medications? The problem with chronic constipation is it can lead to something called megacolon, where your colon is just enlarged and you can develop infections, it can burst. That's why we have laxatives, right? The doctor is going to probably give someone a laxative to try to stimulate the release of this waste. The problem with laxatives is they destroy the lining of the colon, and also it's hard to come off of them. Your body depends on them. With the diabetes medication, what that does is it gets the sugar out of the blood to help normalize the blood sugar. But the question is, what does it do with that sugar? It's pushing it through the kidneys, pushing it out through the urine. Of course, when someone has this symptom, they're then put on medications that cause urinary retention. Then they get a risk for urinary tract infections. Dizziness is another really common side effect of quite a few medications. One big problem, especially with the elderly, is that dizziness is the number one cause of why someone, when they're older, falls. So dizziness comes from like taking high blood pressure medication, antidepressants, and even sleeping pills. There's also something called paradoxical drug side effects. You're taking a medication for a certain effect, but you end up getting that same effect. This happens quite frequently too. You're taking an antidepressant, but it actually causes you to become more depressed. Or you take an antacid and then you end up getting heartburn. One of the biggest reasons why people develop chronic disease, I personally think it comes from what the patient eats. I'm primarily talking about processed foods. Junk food is at the top of the list as far as the reason why people go to the doctor for their chronic disease. A really big part of Big Pharma's medications are really about treating the side effect from this processed food. Because the doctor does not really evaluate what the person's eating, it's the doctor's omission of real food and that connection between junk food and chronic disease that is literally holding this whole thing together. And it keeps allowing the drugs to be prescribed and then new medications added to treat the side effect from this other drug. What is the one thing that can literally turn this whole thing around? It's this tiny little simple thing where we're going to switch out the junk food for real food. And if you want more information about what real food is, you should check out this video right here.